Intense eyeballs, head versus tree, and what in the Wolverine is happening here? Today, we're breaking down and reacting to the disturbing medical scenes and colorful injuries from Sprunki. Let's dive right in. Really interesting are pupils. They dilate or they constrict. So miosis versus mydriasis. This is regulating the light that goes in and out of our eyes. So if it's really bright out, we're gonna constrict down. And if it's really dark, we're gonna dilate up. It's like some rough, heavy metal. I feel like I'm gonna have a seizure. When your autonomic nervous system kicks in, your fight or flight, you're gonna dilate up. You're gonna run away from the bear and you need to run and see everything and take in all the information. Oi! Multiple different injuries to the head with the red stuff. This is actually quite common in the emergency department. People fall is probably the most common reason why you have head injury. The biggest thing we also worry about is cervical spine injury. A lot of times people who do have these falls will put in a seat collar, they'll get evaluated, and then we will check first a nexus criteria, which is criteria for examining the neck. Look at that neck! We need to get a CT scan of the neck. The blade comes out and the door shuts. I think that's a smart move. Having some hyperventilation, breathing really fast. What ends up happening is you're actually blowing off a lot of CO2. If you blow off too much, you're gonna get carpal spasming. We actually try to get them to breathe into a bag because we want them to keep some of the CO2. Midline thoracic injury, hard to do. You have your sternum in the way as well as a rib cage, but you can go in between. I've seen that before where somebody slips a knife in between. Mr. In between. You worry about puncturing the heart, either the atriums or the ventricles or even the aorta. Seriously detrimental things that you have to worry about. If there is a hole in the heart, you don't know it truly until somebody significantly has bad vital signs, really poor clinical presentation. We have a cervical neck fracture. Osteopathic physicians as well as chiropractors do a technique relating to the cervical spine manipulation. The idea is to put your body back in balance. Oi! GSW, gunshot wounds, single bullets to somebody's cranium, aka head, yes, can cause detrimental effects. And sometimes it might skim off, sometimes it might cause some bleeding, but survivable. Depends on caliber, distance, and what area of the brain is actually hit. Small hole in, bigger hole out. Oh, geez. Oh, wait a minute. Hole straight through. So I don't ever see that. Facial lacerations, but without hitting the eyes. Likely you're gonna hit the eyes and you're gonna have an open globe laceration. The biggest thing with those injuries is not to touch it. Don't touch it! Because of the fluid. You wanna make sure that you just close your eye and maybe have a protective cup over top of it. Massive facial injury. You can have a lot of facial injuries and still be kicking. It just has to do with the amount of blood loss that you're having, so you can't perfuse your organs. And then thereafter, okay, how do we repair this? Massive injury to the lateral aspect of the neck. I always discuss neck, basically between your collarbone up to your jawbone. Highly vulnerable area of injuries. Your major blood vessels, they're there on both sides. You can bleed out pretty well. Interesting. This character ends up wiggling and dancing on the floor. Is somebody passed out? Are they in pain? Or are they actually having a seizure? Typically, seizures are rhythmic versus we see people who shake and move in all different directions. Sometimes this is a psychogenic seizure versus a hypoxic event. If somebody's actually truly having a seizure, roll them on their side, pad their head. Don't try to stop the shaking. Do not put your fingers in their mouth, nothing like that. Typically, seizures will stop after a minute or two. Oh, trying to help. We can actually tell when somebody's in a lot of trouble just at the way that somebody is breathing. Shane Stokes versus Kuzmal. Sometimes we see agonal breathing. Those we do not like. We need to intervene because soon that's going to stop. And then with no oxygen, you're going to go into cardiac arrest. Cardiac arrest. Massive traumatic injury to the brain. You can have bruising of the brain sloshing back and forth without skull fractures or rupture of blood vessels. You can have subdural, epidural, or a subarachnoid type hemorrhaging. Uh-oh. Oh my gosh. I've actually witnessed people who actually bite other human beings and have to come to the emergency department. People are not for biting. Please don't do that. Could you live without half of your brain? Could happen. I do see people come in who've had massive injuries where half their brain is gone and they're still around. Now they're not 100% themselves anymore. Oh, projectiles. You have a rebarb, say, through you. If it's not so big and long, I do not recommend pulling it out at this point. My classic line, please do not pull this out. Whatever it's damaging, it's still holding it together. This is either through the lung, this could be through your liver, this could be through any intestines or your stomach. Uh-oh, that's never good. Uh-huh. For some people, watching or playing something as intense as Sprunki might make their heart race. That's where chillax comes into play, to help find calm vibes when life throws unexpected chaos your way. If you want to learn more, check out chillax@lifehappens.com or find it on Amazon. Do matrix duck. Oh. I've seen circular saws take fingers off. I've seen big machines that do crushing where people get stuck and they end up losing hands. If anything happens like that, control the bleeding, bring pieces if they're not on you quickly to the hospital. They are not happy here. Get in there. Oh, it's like a whole family. Interesting.
Interesting.
We got a lot of bandages. We got some people on the ground, the young ones. Pediatric patients, when they actually come to the hospital, the whole place gets really nervous, especially when it's not a pediatric hospital. We always want to make sure that the patient's doing okay. Every single ER doctor is trained in pediatric and adult medicine. There are doctors that are specifically trained just from pediatric emergency medicine. Really interesting, pretty intense, getting the whole vibe about it. But if you guys enjoyed my reaction to this, and want to know more or want to see more, let me know in the comments. And as always, do me a favor, watch this playlist, binge watch everything, and subscribe. Turn on your bell notifications and hit that like button for me. Thank you so much for watching and stay healthy, my friends.